Imagine a hospital room filled not just with medical equipment, but with laughter, art, and moments of genuine connection. Across the country, if joy is so healing, if it's as essential to our well being as clean water or nutritious food, why do we tolerate a world where it's a luxury for some and an impossibility for others? The quiet desperation of feeling constantly overwhelmed by a world that demands too much. For many, joy isn't just scarce, it is structurally denied. To understand the real world impact, take the crisis in Black maternal health. For decades, Black mothers have faced alarmingly higher rates of complications and mortality. This isn't biology, it's the physiological toll of navigating a healthcare system with documented bias and living in a society that imposes a chronic weathering stress on Black bodies, helping mothers and babies to thrive, not just survive. Their message is clear: everyone deserves joy, especially in life's most vulnerable moments. Or consider the profound impact of green spaces. The most effective prescription might not be a pill, but a park. We can design an architecture of emotion, creating environments that don't just serve our physical needs, but also nourish our spirits. This isn't about ignoring hardship or pretending pain doesn't exist. It's about recognizing that joy is not a luxury, it is a vital, functional component of human flourishing and a powerful catalyst for healing. It's a strategic imperative disguised as a feeling. Leaders aim for Ted Lasso level kindness, coaching joy daily. By bringing these diverse voices together, we empower them to become architects of their own experience, shaping joyful, dignified, and truly helpful moments all across the care journey. MRI machines are redesigned as submarines or spaceships, turning a terrifying procedure into an adventure and dramatically reducing the need for sedation. At the other end of life spectrum, in hospice and end-of-life care, the focus shifts from cure to comfort, from duration to dignity. Here, joy is found in meaning and connection. When joy is intentionally designed into our systems, the effects are profound and measurable. First, well-being rises, not just for patients, but for staff. An environment that prioritizes positive emotion is an environment that combats burnout and fosters resilience. Joy isn't just a feeling, it's a biological advantage. Make joy part of the prescription. Make it a line item in the budget, a key performance indicator, a non-negotiable element of your design brief. Joy isn't a fleeting emotion, it's a physiological state that builds resilience, speeds up recovery, and can even extend our lifespan. Now, consider the economic impact. What if hospital funding and public health resources were linked not only to survival rates and readmission numbers, but to the aggregate joy score of the populations they serve? Imagine earning wellness credits for taking a painting class, buying concert tickets, joining a hiking club, or even spending dedicated time with a therapist. We would finally collectively believe that joy is not a luxury, but a vital sign of a thriving individual and a flourishing society. Joy isn't fluff, it's function, and maybe it's time we design like it matters.